Hello, everybody. I told you I would come back after 3 months and do a video to kind of show you the progress. I did go see Dr. Dawa last week, I think, and for my 3 month checkup. And he took pictures, for the after pictures. And he gave me some Botox in my forehead. And I did get more filler through here, so I'm a lot happier with the results. The sagginess isn't as bad. I've also been on SkinCeuticals for over a month now. It's a fantastic skin line if you're interested in a good skincare. It's not cheap, but it is good. I can tell a difference. Dr. Dawa told me everything was looking really well. My incisions are healing really, really, really well. You can't really even see them. And that, everything's going good. And I love the fact that he said my fat transfer is it's here. I don't have to get filler in my cheeks anymore. I'm so glad for that. I'm trying to think. I went to an esthetician yesterday and I got a skin peel. I'm going to start getting those regularly. Dr. Dawa explained to me that although lasers are good, they're just not good for me. He does not feel like I need to be getting lasers. He thinks a skin peel, regular skin peels, will do the same job as a laser. And lasers are like, I guess, $2,000 every 6 months. Whereas a skin peel can be like $100 every month. I don't know. That's $1,200 a year as opposed to $4,000. So it's a lot cheaper just to do skin peels for me. I'm trying to even out my skin and still get some tightening through my skin where I've lost the elasticity. But overall, I'm just going to say I am very happy. I'm very, very happy with the results. I have zero regrets. I'm glad that I did it. I'm just very impressed with my doctor. I'm trying to think. I had to get dental work done this last week. I had to get a crown and some fillings because of when I was pregnant with my baby, who's now 31. My wisdom tooth broke, which infected 13 of my teeth, and I had to get some fillings and some crowns. Well, I just noticed some pain, and I went back to my dentist, and he said that he's just having to replace what he did 30 years ago, but I didn't have any new cavities or fillings, and I'm so glad for that. Dr. Dawa did tell me that if I wanted, he could do a lip flip surgery where they just do like a bull ring cut here and they barely lift your lip, just barely. But because when you talk, supposedly you should see your top teeth. But I am not going to get that involved in my looks. I'm really not. And my husband said he's afraid I would look like, kind of like a little pig. So we don't want to do that. So I'm going to be happy with what I have. I'm going to be grateful. I'm going to maintain my facelift. I've had several people ask me, Allison, why are you doing such rigid skincare now? And why are you getting skin peels? You just had a facelift. And I think it's because to maintain your facelift, you have to maintain your skin. And I figured, I got a second chance by getting this facelift and my neck lift, that why would I not want to maintain the skin to maintain the facelift? Dr. Dawa said I'll get more longevity from the results of my facelift if I take care of my skin. So what I'm going to do, guys, is come back. I go back in 3 more months, and then I will do another video and see the results, and then another 3 months. After that will be a full year, because I told you guys at the beginning of this journey I would try to do regular videos and then check in for sure on my year so that everybody can see the progress of a facelift. I do want to say with the brow lift, I am having no issues, but the itchy, I just can't scratch it enough. But it's deep inside. It's like you can scratch and scratch and scratch, but you're not satisfying it. Dr. Dahlwood told me that was very normal. That is actually the healing process. Your nerves are healing, your everything, the tissue, everything inside is healing. So be ready for that. When he gave me my Botox, I asked him not to get too low on my brows. I want to still have some movement, because after going through all this brow lift and everything, I did not want my brows drooping. So I still have some wrinkles, some right there, but I could go back to him and get more Botox, but I don't think I want to, because I don't want to risk the drooping eyebrow. So I'm actually pretty happy with it all. He gave me Botox on the side, so I don't get that. I did get a little more filler, not in my lips, but he gave me a ridge on my upper lip. He gave me a ridge last time on the bottom, so then he gave me the ridge on the top, so it just looks more natural, I think. And I'm so glad I don't know how to do my YouTube where I can get comments, because I would just die over any negativity I might get from this. It would just break my heart. So I guess I'm a chicken. And I'm not doing this so that I can get feedback and people tell me good or bad things about me. That's not what it's about. I'm doing this just to inform people who are interested in getting this done. I'm really just trying to be a help, since I'm in the beauty industry, and I know women, and I know that it's important to have a lot of information before you do something, and I'm just trying to be helpful. So I appreciate you watching. I'm hopefully answering any questions you might have. Yeah, I think that's about it. So goodbye for now. I will check back in 3 more months, and we'll see if much changes. I am getting thinner through here. The swelling's going down. I think it's looking more and more natural, much more natural results than a lot of different facelifts where I've seen where women have just looked really pulled tight and their lips pulled and everything. So I have a great plastic surgeon, guys. And I also want to say I serve a mighty God. So definitely prayer. All right. Thanks, guys. Bye.